by 2050, 50% of the population of the world will be myopic.
A child who's born with a refractive error has never seen clearly. So they'll not get up and start complaining that, I cannot see.
When the child is having a refractive error, they can't see things very clearly. The brain starts to think, okay, this is where the world ends. So forever, the vision development only ends at about 50 to 60 centimeters, beyond which everything else is blurry.
If the push for wearing glasses comes from the family, it becomes easier for the child to go outside and wear glasses in the society because it's still a taboo.
So what is more important is the vision is important, because if you're having power and you're not using glasses, you're sitting in your class, you cannot focus, your education is going to take a hit.
Once the number is there, it is bound to stay. There is no drop to even reverse your cataract. There is no drop to reverse your eye power.
Later, if you're not willing to wear glasses, there are very good options and very safe options that you can explore after a certain age.
Vision correction is not the future, it's here. Imagine this, a 13-year-old in Delhi squints at the blackboard. A software engineer in Bangalore can't go an hour without adjusting her glasses. A father in Mumbai hesitates before playing cricket with his son for fear of breaking his glasses yet again. Hello everyone and welcome. My name is Dr. Supriya Sriganesh and I'm an eye surgeon practicing in Bangalore. Today we're here with 6 of my good friends and colleagues who are prolific refractive surgeons from all over India.
Hi everyone, I'm Dr. Aditya Varman. I'm an ophthalmologist practicing at Umma Eye Clinic, Chennai.
Hi everyone, I'm Dr. Anuja Desai. I'm an eye surgeon practicing at KD Hospital, Ahmedabad.
Hi everyone, myself Dr. Rohan Bori, a cataract and refractive surgeon from Innocent Hearts Eye Centre, Jalandhar, Punjab.
Hi, I'm Dr. Sutaj Garewal. I'm a cataract and refractive surgeon practicing at Garewal Eye Institute in Chandigarh.
Hello everyone, I'm Dr. Advaita Yalampur, cornea, cataract and LASIK surgeon at Envision LASIK Centre, Hyderabad.
We're going to talk about everything eye care. We're going to bust some myths. We're going to talk about myopia, spectacle correction, how to get rid of your glasses, and whether you can do that after the age of 40. Some things that everyone should know about their eyes. So before we get into the serious stuff, let's start with something fun. I want to ask all of you, what is some of the most interesting things you've heard in your clinic, in your practices, and maybe some myths that you'd like to bust?
So we hear some crazy things, especially from parents. Unfortunately, it comes from parents. So actually what happens is I prescribe glasses for the kids and they come a year after a year follow-up and somehow the kids are not wearing glasses. So I ask the parents, how come they're not still wearing the glasses? They say, no, once we start wearing the glasses, they'll get used to them. So this is very commonly we hear, and unfortunately, they don't understand about the lazy eye, ambylopia. So I have to sit and explain the patient about ambylopia, lazy eye. So I think it's really important they understand that if the glasses are prescribed, especially at school-going age, it's important that they wear the glasses continuously. So I think this is one of the most common thing that we see in my practice. So
that's a great point. I think Aditya also mentioned that he experiences something similar.
Yeah, exactly. So this is really difficult for us to convince the parents. So they think that once the child starts wearing the glasses, because they're wearing the glasses, then the myopia keeps progressing.
Yeah.
What we have to understand is, we have to tell the parents exactly why the anatomy of the eye is changing and why the eye power increases. So we have to tell them that the eyeball length is so and so. As it keeps increasing, the child is also going to get a little more power as they get older. And it's very important that they wear the glasses correctly so that normal visual development does take place.
Yeah.
Rohan, you had an interesting experience.
Yeah, so the thing is, you're talking about the experience regarding what are the myths regarding the patients. I'll tell you a funny story. So recently I was doing a patient spectacle removal surgery I was doing. So we, by the norm is that first we do the right eye and then we go for the left eye. So I did the right eye, the surgery went perfectly fine. And that boy on whom I was operating, he was about to get married in a month or so. So her wife also wanted to get the same surgery done. So once we were done with the right eye surgery, and I was telling him that now, yes, we are preparing for the left eye surgery. So keep on following whatever instructions I'm giving you. Suddenly he says like, doctor, please wait. Meka, what happened? Can you please call my wife and I want to talk to her? Meka, right now you want to talk to your wife? Yes, sir, right now, because I just want to tell her that, yeah, it's very safe, it's very comforting surgery. There's nothing much happening inside and yes, I'm free in a minute or two. That was really the whole of the operating room, the staff and everything, they just bursted into laughter looking at that funny side of the story. So yeah, these are some funny things which keep on happening. Also, along with what the myths which we have amongst the parents regarding their kids' eye health. So I think even Siddharth sir and ma'am also have some same kind of myths what the parents feel.
Yeah, so from my experience as a myth, more than a myth, it's a reaction that sometimes when, parents find out that their children need glasses, obviously it's an emotional change, but they act as if it's the end of the world.
Yeah.
And what I always try to tell the parents is that, you have to understand that if you're going to react like this to your child wearing glasses, you're making it into something negative. There is no alternative for your child. They need glasses. They're going to perform much better in school. They're going to do everything. They'll be more confident. Let's try and make this a positive thing. Because if you're going to make it a negative thing, the child is going to be averse to glasses. And I think that's the wrong way to start off with it. It's an essential tool. They need it. So I think being positive about it at that time is very important.
I think I'll add to that. If the push for wearing glasses comes from the family, it becomes easier for the child to go outside and wear glasses in the society, because it's still a taboo. Wearing glasses, it's still a taboo. So if the push for wearing glasses, the positivity, as he's mentioning, comes from the house itself, I think it becomes easier as the child grows.
We all know that by 2050, 50% of the population of the world will be myopic. And it's a silent epidemic that's happening under all of our noses. We don't even know that it's an issue and people don't know. So what do you think that some of the signs are that parents can look for if, to get their child for an eye checkup to suspect that they may have vision issues?
Yeah, so I think now, especially school-going age, it's really important that they screen the kids every year, annually. And I think a lot of hospitals are actually doing screening camps at the hospital, at the school. So I think it's really important that, especially if the parents are myopic, they're wearing glasses, at least from the age of 6 years, they get the screening done. So the signs they need to look out for if the child is squinting. Sometimes, they do like this to watch the television, or sometimes they go very close to the television. And you can ask the teacher to see, because the backbenchers, sometimes they write the notes, but they copy from their friends. So these are the signs they need to look for. So I think that's really important. And it's really important that they do the screening at a very early age, because if it's detected early. And another thing what happens is sometimes the kids are coming quite later and the number is -2. So the parents are like, oh, number is -2, I can't this thing. They can't accept it. So then we tell the patient that it's not about the number. It could be -2, -3, 4, 5. What is more important is the vision. If they're reading 6x6, that is important. Later you can go for a laser vision correction, or there are some myopia control glasses or the drops. So what is more important is the vision. That is more important. So that's how we have to educate.
Absolutely, I agree with that completely. And the child's visual and retinal development happens till the age of 6. So what would you say is the earliest one can bring their child for an eye checkup?
So I feel as long as, the parents don't notice any squinting or anything else that is abnormal in the eyes, definitely before the age of 5, but I feel ideally even 3 works quite well, because children, sometimes they can be born with refractive errors, sometimes maybe a refractive error in only one eye leading to a lazy eye. A child who's born with a refractive error has never seen clearly. So they'll not get up and start complaining that, I cannot see. They're very well adapted to that. So it's very important that even if you feel your child is absolutely fine, not having any issues, bring them in for a screening, even at the age of 3. That's a good age where we can say that, okay, there's nothing to worry about, or maybe we want to do a few more visits to rule out any kind of a refractive error. But I think school vision screening also is very important. But by the age of 3, and definitely before the age of 5, even if you feel everything is fine, a checkup is critical.
I had a friend who's a very vigilant parent, and she just noticed her son's eyes blinking frequently. So he didn't have any squinting or issues at school or anything, just 2.5 years of age. But she noticed that while playing, he just keeps blinking so frequently, and she just flagged that as a red flag sign and brought him. He had a -2 astigmatism. And he's so comfortable with glasses, and even his personality has changed a little bit. He's more active, so it can make a great difference to the child. So what do you think? I mean, we always, screens are the villain.
Yeah.
If you meet any eye surgeon, they will tell you, keep the screens far away, reduce screen time. But how much do you think we can attribute to the screens, and how much do you think we can attribute to genetics?
So obviously we all know that genetics play a very important part, but that is not the only cause of the child having myopia. And nowadays the screen time has surged a lot, specifically post-COVID. I mean, when we were kids, we couldn't wait to finish that homework and go outside and play. But I don't see that happening in kids nowadays. And I myself have got friends who video call me because their child is on the screen all the time. And they video call me just to say that if you don't stop watching the screen, Anuja auntie will do something to your eyes. I mean, it is that significant.
Yeah.
So again, it comes from the parents, how they restrict the screen time, specifically before the age of 5, how much control they have in their houses, the parental controls that we talk about. So screen time definitely is the villain nowadays, and that again will lead us to a very high surge in myopia progression.
Yeah.
So, as a parent who's trying to restrict screen time, having trouble feeding the child, as parents, you guys know how much of an issue that is. So, what would you say is the limit? How much screen time is allowed? What are the kind of lifestyle changes you need to make for your child?
Yeah. So just like how Dr. Anuja mentioned, so post-COVID, all of us would have noticed we have so many of these children coming in with absurdly high powers. So there is a direct correlation between how much screen exposure a child has and how their myopia progresses. So as a parent, you have to understand that you have to have hard limits on the amount of screen time that you expose to your child. Yes, it's very difficult nowadays because the kind of videos that they have on demand on their phones, their iPads. So one video gets over, the next one gets suggested. It's a vicious cycle. It's not like how it was before when we were children. We watch one program and that program is done and we go back and do our homework or go out and play. This is a vicious cycle that's going on. I mean, there's screens and iPads and whatnot. And they have such bright colors in all of those videos.
I was going to say that, yeah.
So it's incredibly addicting, right? The child can't help it but keep watching. But whatever the child does, however bad their tantrums are, you have to have hard limits. So have a limit of maybe about 45 minutes to 1 hour per day, not more than that.
Right.
And if you have to show your child a video or two every day, please have a distance of at least about 60 centimeters away from the screen. That is very, very important. And even if the child does throw a tantrum, don't give in to it. With my son, what I do is, I tell him if he's throwing a tantrum, you finish your crying and then we can resume whatever you want to do.
Yeah, exactly.
So that's it.
Same.
So if you still give into that and you continue to show them the screens, you're giving them temporary gratification, but you're sacrificing a child's long-term eye health.
Exactly.
So I think another thing is I think parents should set examples because parents come, they're using the phone. Sir, my son is using a lot of phone. But if you set the right example, that is very important.
And also, what I do with my kids is that I don't give them any tablets or phones. If they need to have a screen time, it's only television. Only television, and they're sitting on their beds. No screen time on the mobiles. And yes, as Aditya also said that 45 minutes to 1 hour, I think there are certain guidelines set by the Indian Academy of Pediatrics that before 2 years of age, no screen time. 2 to 5 years of age, less than 1 hour of screen time, and that too guarded one. And the scientific videos or Nat Geo geographical channels or not. And 5 to 12 years of age, less than 2 hours of screen time. As Dr. Advait rightly said, the first thing is the lifestyle modification of the environment where the child is living. So that starts from the parents. Restricting your own screen time in front of your kids. That will help the most. Second thing is, when you consult a doctor, you need to have a serial follow-ups. Be it if you are one time you have been detected that you are wearing glasses, you need to go every year for a follow-up to see whether your glass number is the same, has it increased or not. So yes, serial follow-ups, lifestyle modification, correct drops and correct glasses. This is the future.
And siblings as well, right? If one child has myopia, it's better to get the other children also tested, even if they're not symptomatic. And for parents, I think it's really important to know that there are treatments and it's important to get it done. We've all seen so many children with myopia, and one interesting thing that we all see in cartoons and screens and the personality of a child with glasses is portrayed very differently from a personality with a child without glasses. The guy without glasses is always the hero. So what do you guys feel about our responsibility also of representing children with glasses?
So what we feel is that more than educating a child, it's also important that whenever he goes in the class, it's the teacher who is regulating the class. So the teacher has to teach this to all the students. Basically, whenever you go, other child is wearing glasses, definitely that child will be bullied. Like, teri to 4 aankhein hain, you have 4 eyes, or you are the one who is more nerdy kind of a person, not into sports and everything. So that way is the teacher will help, and wo teacher ko kahan se milengi? When we conduct regular school screening programs. There is when the doctor will guide the teacher that yes, these are the problems which you will be facing. The child will be bullying each other. So how to deregulate it, and how to regulate it, and what are the various measures how we can control that.
I think it's also important not just educating the parents alone, but educating the entire household
Yeah.
that the child has to wear the glasses. Frequently, it's the grandparents and other relatives in the house who say, why is your son now wearing such thick glasses? Is that really necessary? Yeah, so that's where the cascading effect really starts. So we have to tell them, no, listen, the power is there for your child to see well and function well, perform at school and be able to do his day-to-day activities very routinely. He has to use the glasses at this moment. Later on, when he's older, maybe he can shift to contact lenses when he's more responsible and he can maintain it very nicely. And then later on, after the age of 18 and so on, they can do a corrective procedure and be glass-free. So that has to be said beforehand itself, so they are more calm to go ahead and encourage the child to wear glasses.
Great. So I think we're all kind of on the same page that the proximity of the screen is the problem and not the screens themselves as such.
Absolutely. I think it's very wrong to villainize screens themselves. Screens have been around for decades. Myopia and its progression is a relatively more recent phenomenon. I think what has changed is how we use these screens. Now, earlier it was a television, certain feet away. Now it's in our hands. And I think just because of posture and laziness, it's not just that, we keep the screen like, at an arm's length. We keep it right in front of us.
Yeah.
And as, it was mentioned that the content is so engaging that you're looking at this for maybe even hours on end.
Yeah.
That is the real problem. It's not the screen itself. A lot of people feel that the screen emits UV rays or something. It's an LED screen. These are LED lights. It's the same. It's how we use screens that really matters. And I think that's where these points of, introducing control, setting examples for our children is what really matters. So rather than just villainize screens, we must teach our children how to use them. What are good habits? What are healthy habits?
Even if you're holding a book this close by, it's going to have the same effect.
Absolutely. But it's just that a book, you'll tend to get distracted. You're changing a page, you hear something, you look up. But a screen, you will not. You're just engrossed for hours.
Yeah, because even before the screens were there, we used to say the nerds, they have thick glasses and all that, right? So that was...
So the more amount of near work, the more, but it has the same impact as not any other factor for myopia increase in the child. More the near work, less of outdoor work, less of vitamin D, we can say, how we counsel our patients. So near work has the same impact.
And I think that's where the 20-20-20 rule also really helps.
Yes.
Not just for computer vision syndrome, but I think overall for near vision also.
Near vision
that
also.
every now and then look at something far away.
You said the word nerds. So I just want to talk about the personality development of the child as well, because it's so different. One aspect is when a child comes to you before you give them glasses and they have a problem, they focus on things around them because they're so nearsighted. They end up being a bookworm because that's what they can see. They don't get into sports and things like that because it's a distance activity. And have you guys had experience about in this? I'm sure you see a lot of children with myopia, and does it affect their personality development, do you think?
So I think we used to get ragged at, like kids having soda buddhi glasses, they call them. We get ragged at. So that's one reason why a lot of kids and parents also hesitate to give the glasses. But if you actually do a screening camp in school, more than 40 to 50% will actually have glasses. So I think that's really important. And it's not about personally. I think glasses are there and it's here to stay. I think parents and kids should understand that what is more important is the vision. And if kids are really worried about glasses, I think now you're getting colored frames and different kinds of fancy frames, which will make them look even smarter. So what is more important is the vision is important, because if you're having power and you're not using glasses, you're sitting in your class, you cannot focus, your education is going to take a hit. You might have to copy from your friends' notes. So there are multiple things that will happen. So what you need to look at the risks and benefits, right? So in that way, I think you need to wear glasses.
I think kids don't come back from school and inform the parents that they are being ragged, or maybe they are wearing glasses when they leave their houses, but they don't end up wearing glasses in the school because of the societal pressure. And then when they come back, they're again wearing glasses. So parents don't actually come to know that the kid is not wearing glasses when he or she actually needs to wear the glasses.
Societal pressure is such a great word.
Yeah.
Right? I think even it's our responsibility as people who make content and even filmmakers and things you see on the screen to portray that a child with glasses can be, there's this classical divide between Clark Kent and Superman. At the moment, and Clark Kent is the same guy. The moment he removes his glasses, no one can recognize him because of the persona.
I think even that Hindi movie Rab Ne Bana Di Jodi, I think Shah Rukh Khan is he's wearing glasses and she can't even recognize him with the glasses. That's
I think another one of SRK's movies, he was wearing glasses, and I think he was breaking the taboo of being called Chashmish. So that was one.
These days, all the celebrities and everyone, they're using glasses on screen also. So for a fashion statement also. So it's not that they have power. So it's coming on the same thing, that rather than the children being bullied and being called a chashmish, now the people are actually wearing glasses just for the sake of it, just to try on different frames, because you see the trend is changing so fast. Every other week there is a new style of frame already available in the market. So why is that? It's not that because the child is being called chashmish, because the people are sending out that yes, if you want to wear glasses, if you want to look good also, just 0 number glasses people are wearing, not they have number. That way.
I'll often point out to patients, parents and children, that even our Prime Minister wears glasses. So glasses are not limiting in any way. And once you are of the appropriate age, if you want to take up a career, which, will be better off without glasses, that's an option. But right now we're only focused on your growth and development. And you'll be able to see better, function better with glasses. So do that.
You're telling your patients that the same thing you're telling your patients, even Prime Minister wearing glasses, I'm wearing glasses.
So I think that's a very important point to make. So sometimes we really can't break that mindset that wearing glasses is a taboo. So the other way to work around it is you have to encourage the parents and tell them, yes, your child does have a glass power and they do need these glasses to see well and work efficiently and carry on the day-to-day activities. Ensure that they wear the glasses at least until the age of 18.
And even till the age of 18, you can actually control the power of, you cannot, at least you cannot reduce the number, but at least you can stop the progression. So I think educating them about what the real reason for not wearing glasses, there's something called lazy eye. So maybe one of you can just tell the audience what a lazy eye is, what is ambylopia in simple layman.
So essentially what happens is, if a child does not wear the appropriate glass prescription from a young age, so the developing age is usually between the ages of 5 to 12. That's when the vision starts to really develop. When the child is having a refractive error, they can't see things very clearly. The brain starts to think, okay, this is where the world ends. So forever, the vision development only ends at about 50 to 60 centimeters, beyond which everything else is blurry. Unfortunately, what happens is, if a child is born with such a refractive error, they don't know how to vocalize this to their parents. They think that this is what normal vision actually is. So unless the parent goes to an ophthalmologist and gets a yearly exam, they won't know whether their child's vision is healthy or not. So unless the correct glass prescription is worn at the right age and yearly follow-ups are done and we keep changing the prescription appropriately, the child's vision will be stunted forever. It goes to a point that later on, if it's too late and then the glasses are worn, then there's no point, because the vision still is not correctable anymore.
It's about nerve stimulation as well, right? The retina gets stimulated by distance images, intermediate images, near images, crystal clear vision. It's stimulated. So this also happens when one eye has a higher power and one eye doesn't have a very high power. So there are two images coming from two different eyes, and one eye is seeing more clearly. So the brain automatically suppresses the other eye and says, okay, I don't want this blurry image, I'm going to use only this eye. So the second eye turns lazy, and the child can also develop a squint. And this, you cannot really reverse this. So that's how important it is to correct your child's visions earlier on.
And many times I like to describe it almost as a learning disorder, that the brain just has not learned to see clearly from that. And then I tell patients that, the only way the brain learns is by doing. That's why if you want the brain to learn to see better, if you want to treat a lazy eye, you have to force the brain to see out of that eye.
Yeah.
There's no surgery, there's no drops to teach the brain something. So that you have to go through that process.
And after they cross the age of 18, once the power is stable, there are a plethora of options for them to undergo a procedure and be glass-free for the rest of their lives.
That's a great segue into what we want to talk about next, which is correction of myopia once the child is old enough to do it. So we've spoken to the parents and we've told them that this is just temporary for a few years and they can get rid of their glasses. We're all refractive surgeons. We all do a lot of spectacle correction, removal of spectacles. And vision correction is not the future. It's here. It's been here, in fact, for decades now. And it's a tried and tested procedure. But there's still so much confusion about it. What's the right procedure to select? What is the difference between all the available procedures and what's marketing and what isn't? So let's just have a candid conversation about the differences between the procedures which are available today.
Right. So as you mentioned that it's not the future, it's already been there. Refractive surgery correction, we have evolved a lot in the past couple of decades. There are multiple options available in the market. And if I was a patient, I myself would be confused. I got my LASIK done 15 years back. So that time it was only one option, either you have PRK or LASIK. But now we have evolved into different types of LASIK. We have lenticle-based procedures. We have other lens-based procedures. So it gets confusing for the patient. I think our role as a doctor comes into picture how we explain each procedure in detail, how we tell the pros and cons of each procedure pertaining to that particular patient profile. It cannot be generalized. I cannot say LASIK is good for everybody. I have to see the patient profile, I have to see the patient's lifestyle, I have to see the age, I have to see their expectations first of all, and then guide them on which procedure is best for them.
One amazing point you made is that customization,
Yes.
right? It's not a one size fits all. It's not, marketing will tell you that this is the procedure you should get done. That's a very wrong way of looking at it, misconception. So, Dr. Sartaj, what would you say about how important suitability is and how to tailor the treatment to the patient's needs rather than what they've seen online?
Fair enough. So, that's a very good question. That what should the patient look at when considering refractive surgery? I think the first thing is, a patient should be aware that when should they be seeking out refractive surgery? Definitely after the age of 18, maybe even 20, their refractive power should have been stable for at least 1 year. And I think even more than the internet, how people find out about what procedure is from word of mouth. Their friends had a particular procedure done and the friend will say that, oh, this is the best procedure. And then they will come in to, for a consultation, you do all the tests and they're exhaustive tests. And, we look at so much data and then finally we sort of try to understand that, okay, this is the procedure that I will recommend for you. And then often that's where, a confrontation can begin that, no, my friend had that done. Why can't I have that
They want the
done?
exact same.
And then you have to explain that each eye is different.
Yeah.
And that's why we have different procedures. If there was just one procedure that was the best and for everyone, life would be simpler. But that's not how it is. So we have, analyzed your eye, we've understood your eye, and we're trying to now match it with the procedure that is best suited for your eye. I think it's patients have to understand that patients choose the doctor and then the doctor chooses the procedure. That's ideally how it should happen.
Yeah.
It's a lot of responsibility on us now to give that option and tell our patients that this is up till the age of 18 or 21 where you're going to have to do this, but there are solutions. So let's talk about those solutions, So if a patient today wants to get rid of their glasses, laser vision correction, we've established that the most important thing is to come in and get a checkup and discuss with your surgeon what the best option for you is, what you're suitable for. 60 to 70% of patients may be suitable for all three types of procedures. So Dr. Anuja, what would you say are the differences between the three? What do you speak to your patients about the technology and the recovery time?
So as we have already discussed that there are primarily three options available in the market currently. One is PRK, one is LASIK, and the third one is SMILE. So I usually counsel my patient and explain to them all the three options because I don't want to push them towards one particular procedure. So we start with the basic and the oldest procedure, that is PRK. That is a laser that is done on the surface of the cornea. We move on to LASIK, that is a flap-based procedure, and then we move on to the lenticle-based procedure, that is SMILE. Which procedure is best suitable for the patient obviously is decided based on the pre-op investigations that we undergo, and we already talked about that one size doesn't fit all the patients. Then I try to push them towards which is best suitable for their eyes. With respect to recovery, obviously, SMILE being the newest kid on the block that we talk about is the earliest and the fastest recovery. After that is LASIK and PRK. Nowadays, in the fast-moving world, I believe that we don't have the luxury for downtime on the eyes. So everybody wants a quick recovery. So what are the patient expectations? I ask them, what do you want from this procedure? One is obviously freedom from the glasses, but what else is the additional factor that you expect your vision to be after the laser is done? Based on that, if they seek for a faster recovery, I've had so many patients who have actually come to me the next day and said, I watched a movie in the theater the previous night. So, I mean, it's that quick. So, based on the personality of the patient, the pre-op investigation and their expectations, that is the most important aspect. I guide the patient towards the best procedure that is suitable for them.
So I think a lot of patients sometimes want to get laser vision correction done. They have an interest, but they have some starting trouble.
Yeah.
They don't know whether it's safe, what tests they have to undergo to ensure that that procedure can be done on their eye. So Supriya, can you just tell us, how do we judge if a patient is eligible for a particular procedure?
So, as we all know, when patients come into our practice, we do an exhaustive set of tests. And in that, first is the clinical examination. In that, the most important part is our history taking, when we talk to the patient and find out what is their personality, what they want from the procedure. For somebody who has like 8 to 12 hours of screen time, the best procedure would be something different than probably someone who doesn't have much screen time. Someone who has a low blink rate or a lot of dryness, if they already have dry eye and they're suffering from dry eye previously, the treatment then would be different for that patient. So in my practice, for patients who have mild to moderate dry eye, I choose SMILE, and I recommend SMILE because the incision that you make is the smallest in SMILE.
Yeah.
In LASIK, what happens is we make a large incision to lift the flap, and that disturbs the nerves on the cornea, causing a lot of dryness. So, I mean, people who undergo LASIK have to use drops for a longer period of time than SMILE. But on the other hand, a patient who has a plus power or mixed astigmatism, or that means a combination of a plus and minus power, or a pure cylindrical power, these are the patients who are not suitable for SMILE, and then we then recommend LASIK for them. So a lot of factors come into play. On the first visit, the patient would have to get all these tests done, speak to the doctor examines the eye, we do a series of scans, topography and other things. Then we speak to our patients about what they're suitable for. I believe in making a strong recommendation rather than giving a menu card or a list, because by our experience and the data that we have and the data that we've seen presented and proven, we know that this procedure would give a shorter recovery time or a better result for that particular eye. Post-op, I think the recovery between LASIK and SMILE is very similar. People are back to work in a day, like Rohan said, he was operating the very next day. Typically within 3 days, they're back to work. With PRK, though, it takes a much longer time. In PRK, like Dr. Anuja was saying, we do the laser on the surface of the eye. So there is a little bit of, we have to put a bandage contact lens after the procedure. There's a little bit of discomfort, pricking sensation for the first 5 days, drops for almost 3 months. Have you guys experienced this with patients who undergo PRK? And
a lot of pain post-op.
Post-op pain. So during the surgery, it's a painless procedure, all three. But LASIK and Smile are painless even long term.
Yeah.
PRK, probably for the first 3 months, there is discomfort, pricking sensation, dryness, etc. So, accordingly, price-wise also there's a difference, but it's more of an investment in the lifestyle and, like you said, what the patient wants from the procedure.
So, another thing is, I mean, probably one of you can answer. So now there are so many types of procedures. We have PRK, LASIK, and Smile. And every procedure, there are different companies, like customized procedures. So yes, we are giving options to the patient and patients are confused. And multiple times we do see in refractive practice that patients are taking second opinion, third opinion. We encourage them to actually take a second opinion. So the patient comes back saying, doctor, you said PRK, the doctor said Smile. I'm confused. So how do you justify your this thing, and how do you counsel the patients? What do you tell the patients? Because different places they're going, different procedures, and different companies. Like so company has this customized procedure. The same PRK customized is called something else and a different this thing.
Yeah.
So what do you tell your
Brand
patients?
names.
So I think what we could tell the patients is, essentially in a laser vision correction, the physics of it remains pretty much the same in all the procedures.
Yeah.
How we go about doing the procedures is where the difference lies.
Yeah.
See, all lasers, we have to understand, it works by remodeling the shape of your cornea, which is the front part of your eye. So how we remodel it is, we have to remove a certain amount of tissue. If it's a -1 power we're correcting, it's a small amount. If it's a -5, it's a little more amount of tissue we have to remove. That's why all of these preoperative scans are very important to ensure that the procedure can be done safely. What I tell my patients is, yes, there's a difference between one procedure to the other, but I am choosing the procedure for you that I am most comfortable with, that I think is the safest for your eye.
Yeah.
If you go to somebody else and you ask them another opinion, they might have another one.
Yeah.
So I tell my patients, choose your doctor, don't choose the procedure.
So I think the answers that we give to our patients, which is the best procedure for them, and as you said, patients are actually entitled for a second or a third opinion. But whatever we inform them needs to be backed by clinical research, needs to be backed by the tests that have been done for them, and which is the best procedure. I have actually couple of times guided the patients towards a different procedure, which probably is not available in my center, because that is the best procedure for them. So we need to realize that what is best for the patient in the long term, rather than taking decisions
FDA
on our...
approval also is-
Yeah, exactly.
Yeah.
So obviously the procedure that you select has to be backed by the governing bodies of the world. So obviously needs to be a seal of FDA approval. There are multiple scientific publications available online, and a couple of us are also doing researches on these procedures. So if it is backed by clinical science, I obviously push my patient, this is the best. So that is when my confidence also increases.
Yeah.
Research can also be a little confusing sometimes,
Yes,
because a lot of
definitely.
studies are, can be funded by the company
Yes.
that is.
Yes.
So I think it's important to understand that there are 3 broad categories.
Yes.
There's PRK, there's LASIK, and there's Smile or lenticule extraction. So within that category, there are so many brand names,
Yeah.
and it's confusing. I think one simple guideline for patients is, when you ask your surgeon, it may be some name XYZ.
Yeah.
Is this LASIK? Because sometimes patients hear a new name which is branded as a new technology, and they think
That is so
it's
true.
more
Yeah, yes.
advanced
Yeah.
than lenticule extraction. But at the end of the day, it's LASIK with a different brand name.
Sometimes even the other doctor doesn't know about that technology.
Yeah.
Like, oh, wait, I have to try it out.
Exactly.
This is new.
And the technology which evolved to the lenticle-based procedure, it took a time
Yeah.
to evolve.
Yeah.
So after that, again, the old technology now being projected with a different name.
Yeah.
It does not. Every year, you cannot have a new technology coming.
Yeah.
It's like if you want to buy shoes,
Yeah.
you want to buy shoes,
Yeah.
you have to decide whether you want Nike or Adidas or
Yeah.
Puma
Yeah.
or whatever. So it's brand names at the end of the
Yes.
day. And just ask your surgeon, whatever brand name it is it PRK,
PRK.
or
Yeah.
is it LASIK,
LASIK.
Yeah.
or is it lenticule
Lenticle-based,
extraction?
Yeah.
So Smile is something which is a lenticule extraction platform, and Smile was FDA approved way back in 2016.
16,
So
yes.
it's been a tried and tested procedure. Over 10 million eyes of Smile have been done, almost 12 million eyes
Yes.
today.
Yeah.
Yes.
And out of 40 million eyes in the world that have undergone laser vision correction, 12 million eyes of Smile.
Just smile.
And that too within a span of these 10 years.
Less than a
Yeah.
decade,
Yeah.
Because the refractive surgery is here since 1990s.
Exactly.
RK was being done.
Yeah.
So of those procedures, 25% have been done in the last
Yeah.
decade.
Yeah.
That too, smile, lenticle-based
Absolutely,
procedures.
absolutely.
So it tells us about the authenticity, the result-driven, and what are the expectations of the doctor from the expectation of the patient from the doctors, the post-operative vision and everything. So this tells us about the technology, trusted technology.
And today, Smile is the only one of the lenticule-based procedures which is FDA approved.
Yeah.
And there's a reason why other companies are jumping into lenticule extraction, because it's a tried and tested
Yes, yeah.
procedure. It's safe. But Smile was the original.
Yeah.
It's the data is there, and that's also why I believe in this procedure.
I think we've covered PRK, but if a patient now has to choose between LASIK and Smile, why would we be choosing Smile? So I think Dr. Sataj is a good candidate to speak about that because he performs only Smile in his practice, no LASIK.
Yes, so that's correct. So for the last nearly a decade, I have only ever been advising SMILE for my patients. And I think, that's where there's a significant overlap in a person who's a good candidate for LASIK and a good candidate for SMILE. Until recently, yes, patients with plus powers would only be suitable for LASIK. And like Anuja said, in that case, I would advise them that you can go to any good practice that is offering that, but I don't. But the reason why I chose to do only SMILE for a long time was very simple, the safety. These are elective procedures. Unlike, let's say, cataracts, this is not a procedure where, we have to do it. For the most part, as doctors, usually it's that, okay, we have to do this procedure. If we don't, then, A, B, or C will happen. These are procedures where even if you don't do it, functionally with glasses, your vision is safe. So if we are doing something, we need to work with that same level of safety. That, what are the downsides?
Yeah.
And that's where I felt that with SMILE, I was offering what is definitely the safest option to my patients, the most comfortable option, the quickest recovery time, as Rohan mentioned, back in the OR, second day, that's incredible. You can treat a significant number of variety of refractive errors within myopia. You can do cylindrical powers very accurately, very safely. What I do feel is, unlike other laser procedures, especially PRK, this is a procedure that requires skill. PRK is heavily machine dependent. It's pressing a foot pedal and you're done. This is a procedure that requires finesse as a surgeon. And I think that's where, some people who've been doing SMILE longer will really vouch for this technology, that this is incredible. But maybe someone who's been doing LASIK for a while and, was very comfortable with that procedure. And now suddenly you have to, as doctors, we have to evolve.
Yeah.
We have to retrain ourselves. We have to upskill ourselves so that we provide the best to our patients. And whenever you do that, we are getting out of our comfort zone. Suddenly we are, struggling with a new procedure. We have to make a lot of efforts to learn it. And there, maybe we'll have a tendency that, I was comfortable with that. Why not just go back to that? Yeah. But in the interest of our patients, which is what really matters, we have to keep improving. We have to get better at these procedures. And that's where I found SMILE really allowed me to give a much better experience to my patients than other procedures.
There's a big benefit for the patients as well, because what we have to understand is any laser vision correction, be it SMILE, LASIK or PRK, there is some corneal sensitivity for a few months. This is what patients perceive as dry eye. They feel that their eyes are burning, they feel a little scratchy or gritty. We find that it is the least with SMILE. Because when you do a LASIK procedure, we make a 24 millimeter superficial cut on the cornea that is going to disrupt the nerves in the cornea and cause some irritation for a few months. That irritation typically lasts for about 6 months, maybe in some cases up to 1 year with LASIK. But with SMILE, it lasts about 1 month, very rarely, maybe up to 3 months max to max. So because the incidence of dry eye is much lesser with SMILE, I feel this is my go-to option, and for the last 10 years in our practice, we've been doing primarily SMILE for myopia.
Have you noticed your patients not coming back to you after SMILE? Because for
That's
me,
the best thing.
I feel like they go away and they don't keep coming back
exactly.
for drops or more chair time, or they're so
Exactly.
comfortable. In fact, they come in from outstation, they fly out in 3 days, and they're so comfortable that I don't see them again, you know. But with LASIK and PRK, they do, the chair time is a lot. They do keep coming back. They have everything you just spoke about, Aditya. They have that grittiness and all that, which we don't see with smile.
For me, it would be, I can confidently tell the patient that you can start your gym, you can start all the contact sports activity, even swimming immediately. I mean, I tell them to start from day 5 or day 7. And then they look at you like, oh, I can start all this. And it's the most satisfying feeling that I am not able to tell that to my LASIK patients. I have to tell them wait for a month at least. But with these patients, and then they don't end up coming back, as you said.
How I sum it up is, you know, like if I get a call back from a patient, and you know, one patient I've done smile, and one patient, let's say, I've done LASIK, and I get a call 6 hours later that, oh, you know, I'm having some difficulty. I'll tell the LASIK patient, come back immediately, I want to see you. I'll tell the smile patient, go to sleep, don't worry. Nothing.
For the LASIK, you need to see the flap.
We are more comfortable as surgeons also, and it's stress-free for us, you know, with smile, because we can just trust that our patient is going to be okay. Even if they, immediately after the surgery, if my patient rubs their eye, I'm more relaxed as opposed to if a LASIK patient says, I've rubbed my eye, then you're like, please come back. I want to see you as soon as possible.
I think one more point that he rightly mentioned is smile. To do smile, you need more finesse, you need more skills and more experience. So not everybody is offering smile, not everybody is doing smile. So a patient goes to a certain doctor who's not doing smile. They give an option of a PRK or LASIK. So that's why we recommend our patients to do their research, do some homework, find out about smile, explore all the options, and then choose the best procedure.
How do you think a patient should choose their surgeon or the institution?
I think nowadays, unfortunately, everybody is doing their research. They're checking the reviews, Google reviews, and they're doing the research. But most of the patients who come to us are word of mouth. So through their friends or neighbors or their colleagues who actually underwent surgery, they find out everything about the surgeon. They know more about the surgery than sometimes my students also don't know about these technical terms that they speak about. So they come to us and they talk about certain technologies and certain things. So they do their research, but I think that is bound to happen and we encourage them to do that. So they do their research, they find out about the doctor, about the hospital, they see the reviews, and then they come to you. So
I think it's important to check what services that hospital offers. And then see if they have the options available, because then that also influences the patient and the surgeon, right? What do you think?
Same ways, because it depends upon every patient is looking at the Google first before coming, what the technology is available latest in the market. If the hospital has it, definitely go first. Talk out in detail to your doctor to know what all procedures can be done actually on your eye and which one you feel that is the best for you. If at all a patient comes to me, I give that patient a proper chair time and I tell him that these are the different procedures which are there and you can select any of these, telling all the pros and cons, and then I say, okay, this is the best. You sit outside, talk it out with your family. If you have any question, write it down. You want 15 minutes extra, 20 minutes extra, I'll answer every question of you in detail before taking you to the OR. Then you are the person who have to decide. Patient listening is one thing which I think we need to develop in order that a patient comes, and because that patient is coming and paying money. Because when we do a LASIK surgery or any smile surgery, it's an elective surgery. It's not an emergency that yes, we have to do then and there only. You are paying for it.
My own sister got smile done, in fact, and I know from childhood how she used to struggle with contact lenses. We were on a flight once and she lost one contact lens. And she was just, really, and she'd not brought her glasses on that trip. So the whole vacation was kind of not the experience that she, kind of expected. So it's it changes your world. So Rohan, I think you can shed a lot of light on this. Is there if you're a person who's suitable for all 3 procedures, which one would you pick and why? And I think you've undergone it recently, so tell us about that experience.
So as sir said, that the safety test, corneal topography, my vision was stable. For the last 7 to 8 years, yes, it was totally stable. So I was a perfect candidate for the same. Corneal topography, very good. So I could have chosen any procedure. Now, having done procedures on my patients, depending upon their corneal profile and everything, So now I also know that how much is the downtime for every procedure. So looking into that, so I saw that the lenticule based procedure, that is a Smile Pro, I thought that yes, this procedure is best for me. And I got it done from the person whom I have learned from, who's my guru, Dr. Sri Ganesh. So I got it done from him. So he asked me that, Rohan, which procedure you want to get done? Like I said, now I am a patient. So now you are the doctor. So you decide for me which procedure I should get it done, because, so then sir said, you also know that yes, Smile Pro is the right now the latest one. And yes, the downtime is really less. And I chose Smile Pro. And trust me, it just takes 8 seconds for the laser. So as soon as I've entered inside the operating room, and yes, when I counsel my patient that it's just 8 seconds. The moment you enter from the door to the OT bed, that takes 8 seconds, approximately, for anyone. Or just to go from your seat to other part of the room, it takes 8 seconds. So I counsel like this to my patients that 8 seconds is just that much time. So as the 8 seconds started, I got really anxious that what is going to happen now? So because when we counsel a patient, we say that the green blinking light will be there, a white cloud will come in front of your eye. The green blinking light might go away or fade. Don't search for it, don't look for it. So as my anxiety was about to set in, the procedure was over. The 8 seconds was done. And trust me, it was totally painless.
Yeah.
Not for the sake of the camera, I'm telling you, but it was totally painless. And crystal clear vision.
What about
within a few hours.
afterwards, the pain and the discomfort levels?
Totally painless.
Okay.
Yes, some amount of glare was there initially for a week or so. It kept on reducing as the day passed by, as I kept on using the drops. So I'm now much more comfortable. Today it's almost 4 weeks that I got my surgery done, and I can completely see. And also the plus point about this is when we tell our patients that it's just a 1-day recovery, actually it is 1-day recovery.
Yeah.
Because I got it done on Saturday, I was home on Sunday, and I started operating on Monday.
Amazing.
And also because we are doing such a fine work, the room of error is just 4 microns, about 4 microns. That's almost the thickness of the posterior capsule. That is the room of error for 4 microns. So if I'm doing fine work on the second day of the surgery, that tells us about the recovery of this procedure and the quality of vision which we get.
And I think all of us spend the most time with our refractive
Yeah.
patients.
Yeah.
And the greatest gratification as refractive surgeons is also from our refractive patients, because
Absolutely.
Yes.
they can see clearly the
Yeah.
next
Yeah,
day,
they're
and
so
such a
happy,
great
so
feeling,
yeah.
right?
Then-
Everyone's
yeah.
nodding there.
When
You
they
don't get to
say-
see that in a lot of other specialties.
Yeah.
It's
True.
only
When
refractive.
they say in the morning that yes, they didn't need to find their glasses.
Yes.
Oh,
Yeah.
I have patients, like when you ask them to place the chin on the slit lamp,
Yeah.
and it's day one. They're first like, oh, yeah, I forgot.
I had a patient who said, Doc, I could see things in the shower this morning. I didn't have to reach for my shampoo and conditioner. I knew
Yeah.
which was which, because they can't wear their glasses in the shower. And in the shower is like a terrible experience because everything's
And the
blurred.
next day post-op, when I see them, I sometimes can't recognize them. Right? Because when they are coming for the consultation in the pre-op sitting, they are very reserved, timid. They're kind of very
Yeah, yeah.
concerned.
Clark Kent.
Yeah,
Clark Kent,
exactly.
Superman, yeah.
But then after getting the smile done, the next day when they see them, it's not just being without the glasses. It's their body language changes.
That's true.
They're more confident. They're much happier that they can finally see well without glasses.
Yes.
It's a big confidence booster for a patient to see well without spectacles.
It's a huge personality shift
Yeah.
that we see in the post-op period. So if you I don't know, we can do research, but if you compare your pre-op and post-op experiences with that particular patient, the way they walk inside the OPD chambers, the way even they dress up, the way they talk to you, the entire confidence boost happens overnight. So that is another instant gratification that we like.
It
There's-
starts with seeing.
Yeah.
They say that,
Yeah.
right?
There's a funny thing. There was a patient. So I told him that when I was counseling him, okay, I got my smile done. Can you show me? I have a video of me getting smile done. So I opened my laptop and I show him, see, this is my guru operating me and I am lying down here. So, yes, sir, yeah, now I can see that you got the surgery done. So, I want to see your pre-op and post-op photo also. Show me your photo with the glasses and without the glasses, how do you look? And can you tell me that will I look good on my pre-wedding photo shoot?
Wow.
Yeah, definitely you look good. You go to your photographer, remove your glasses, get some photos clicked, and then you can also see with the glasses on them. Then you decide you want to get it done or not.
I think only Dr. Rohan gets such patient care.
I mean, his patient
You have to
stories
prove it to
are
them.
the best.
Yeah. Just put it in the wall before, after. Before smile, after smile.
But I
So
think
let's
that's what it is, right? Like it's a journey we go
It
on
is,
together
yes,
with the patients.
exactly. Yeah.
And coming down to like, how should a patient select the surgeon? I think it's most important. Go in, sit down, talk to them.
Yeah.
That is what.
Like do you feel confidence?
Will your
Yeah.
do you feel the safety?
Yeah, do you feel comfortable?
Yes.
absolutely.
And the reasons for getting surgery done, and I know like, yes, the impact we can have in someone's life is definitely amazing. But I'll never forget one experience I had. Did smile for a patient, very happy on day one. She comes in for her 2-week visit, and I enter the consultation rooms, and she's wearing glasses. And I was like, okay. And, quickly I just say, ask her how she's doing. She says, excellent. I go through the screen and everything is absolutely fine. And I still don't want to, address the elephant in the room and examine, everything's fine. I was like, any issues, any pain? She's like, no, everything's perfect. And finally at the end I asked her, I was like, okay, why are you wearing glasses? And she's like, oh, these are zero power. I said, okay, but why are you wearing them? She's like, I love glasses. I was like, then why did you undergo this procedure? She's like, I love glasses, but I hate being dependent on them.
Yeah.
And that's such a subtle thing.
Yeah.
Right? And I was like, that's great,
That's such an amazing point. I had an anecdote where there was an actress who came with a contact lens infection. And she, poor thing, she knew that she had red eye, but she had shoots for like 12 hours a day that she couldn't take a break from. So on top of the infection, she wore the contact lenses. It kept getting worse, and it got to a stage where she couldn't open her eyes. So that's the stage in which she came to us. We treated the infection, the dry and everything, but she still had -6 myopia. So she's essentially completely dependent on the glasses, and she cannot shoot, she cannot do anything essentially. So we gave it time. We treated the dry eye, the infection and everything, and then found that she was suitable for smile. And then the moment she had her procedure done, she was still on table, and usually immediately after the surgery, the vision is slightly hazy. You can't see 100% clearly, but there is a difference. And that difference is so much more noticeable for somebody who has like a -6, -7 myopia. So she's on table. I've done the procedure and she starts crying. So I'm concerned, like, okay, do you have pain? Is there something wrong? What? Talk to me, And she says, no, I'm totally fine. I can see. So she had such an emotional reaction that I was worried about her, but it was just because she could see.
Yeah, absolutely.
And I was trying to tell her that, no, it's going to get a lot better tomorrow, day after.
Yeah.
In 3 days, you'll feel.
In my OPD, we have this box in the shape of spectacles where each patient after refractive surgery, they drop in their glasses.
memento.
We have that
Yeah,
too.
and
As
they
a
take a
memento.
picture,
Yeah.
and obviously those glasses are donated to those in need.
Yeah.
But to add on to Dr. Supriya's story, I similarly had one patient who, after smile, when the patient sits from supine to sitting position, she refused to go out. She was just sitting there for 2 minutes, and we all were worried, like, are you having giddiness or what is this? She's like, I can see. I cannot believe that I can see. And I want to savor this moment. I want to sit here for another 5 minutes and then I want to go out. I said, fine.
I
You
think we
sit
should
and
also enjoy
enjoy
these
the
moments.
moment.
Yeah. So gratifying to
It
do
is,
this
it
kind
is.
of work.
The smile machine, the older one, it has a little step, a platform from which
Yeah.
you walk
Yeah.
off.
Yeah.
And patients when they come in, they're not wearing the glasses. So someone always helps them that, oh, there's a step.
Yeah.
Mind this step.
Going
There's a
back
step.
there.
And always they get up and when they're going out, they're like, I can see this.
Don't help me.
So sorry.
What are your experiences about contact lenses? Because this is a huge myth. I never prescribe contact lenses to any of my patients unless, they force me to.
Yeah.
So what would you say, Aditya, that you
Yeah.
feel about this?
So, the very reason that someone is wearing a contact lens is because they don't like wearing glasses. That's it. But Sometimes they don't take that step forward to get a permanent correction because of fear. They think that laser is risky, or if I do it once, my power will come back. There are so many myths that are being circulated among the general audience. The point that they don't understand is, if they use contact lenses on a daily basis for about 8 years, the risk multiplies.
Yeah.
And they're putting their eyes at far greater risks than they would have if they had a single laser vision correction. And they have spent double the amount of money they would have had for a single laser vision correction. Contact lenses are not a joke. They have to be very meticulously maintained. Has to be hygienic. You've got to change the solutions on time.
Yeah.
In case you don't maintain your lenses very well, you will get prone to having infections in the cornea, which in some cases can even be vision threatening. And they are very, very difficult to treat. So rather than going for contact lenses, you can consider getting a one-time laser vision correction done, which is far safer and also far more economical than using contact lenses for 8 years.
Exactly. The infection rates are also documented to be much less post laser vision correction than with contact lenses. So we have scientific data, there are publications. Anyone can go back and check the infection rates, the complication rates with contact lenses versus laser vision correction.
I think especially in our country, tropical, subtropical, warm, humid, high microbial load in the environment, contact lenses are not. I mean, if you live in, somewhere in the Nordic countries, sure, it's maybe safer over there. But our particular environment definitely poses a high risk for patients who are wearing contact lenses. Just yesterday, I saw a patient who was traveling in India, he was from Turkey, and wearing contact lenses, and he developed an infection, and I was, luckily he recovered well. And the first thing I told him, I was like, please, for the rest of your trip, just glasses. But I think in our particular country and environment, it's a unique risk.
Especially if you sleep with the contact lenses, that's it. And sometimes you forget, right? So you just fall asleep, you doze off. Even if you sleep for a couple of hours with the contact lenses, then that's it. Yeah. So
I think apart from infections, dryness is another important aspect with contact lenses. And all of us have seen so many patients, even if they don't give history of contact lenses, from the corneal finding, you'll immediately come to know that you are a constant contact lens user. So it obviously affects the health of the cornea as a whole. So I also don't recommend contact lenses unless absolutely necessary. Or so obviously LVC is the first choice.
So we have a consensus that LVC is the first choice. So let's jump into the technology side of things. A little bit about what are the lasers and what is the difference between the lasers we use for LASIK, what is used for SMILE in terms of precision.
So basically there are two kinds of laser which are used to reshape the cornea. Number one is an excimer laser, which we do in a PRK, that is the surface kind of a LASIK, different names, touchless LASIK, bladeless LASIK, epi-LASIK, epi, Sara epi. So that is what an excimer laser does on a PRK. And then you have a LASIK. That LASIK in which we make a flap, as Aditya told, that a 24 millimeter flap is made. We raise a flap with two ways. Number one, you can do it with a blade, microkeratome. Or the second is the all laser LASIK or the femto LASIK. That is done with the help of another laser which is called as a femto laser. The same laser which we use for lenticule based surgery, that is SMILE or a SMILE Pro. So these two lasers are there. So frequency and precision, both lasers offer the same. It's not as if one procedure is bad, other procedure is good, because being done for the last 20 years, 25 years, if a procedure is being done because the procedure is validated for so long, the results are there. Otherwise, the technology would have been outdated. It's not as if that if one person is suitable for PRK, other one is suitable for SMILE, then we are degrading his vision. No, we are offering still the same precision to that person. It's just that some procedure is better for other person. So 2 types of laser, excimer or femto, and 3 types of procedure from those 2 lasers, as Supriya told broadly, PRK, LASIK and SMILE. Accuracy, precision, very good, 100% bang on target of both excimer and femto lasers.
That's a great way to put it, because we just spoke about patient experience and recovery and all of that. But with all procedures, precision is bang on.
Yes.
Yeah.
I mean, we are speaking about microns here. So imagine you're taking a strand of hair and you're slicing it to 1/40th of its thickness. That's the kind of precision that we're talking about, and that is laser vision correction. But let's also get into the stability of the procedure, because people are worried, how long will it last? And will I get my power back? So Sartaj, could you shed some light on that?
So stability after refractive surgery is a very interesting topic. And I think that is one of the main apprehensions that patients tend to have. And I think there's a lot of misinformation about it. There are a lot of rumors about it. What you have to understand is the reason why we say that, ideally we should wait till 18, maybe 20, is we're waiting for stability. There's no technique or technology in this world whereby we say, this is your number today and now this is your number forever. A number can change. That's just biology. Even if you're wearing glasses and your number changes, it's not that the glasses have weakened. There are other things inside the eye that change. So same way, when we do the workup for any of these refractive procedures, we are trying to evaluate stability. We'll ask you that how long have you been wearing glasses? When was the last time you had a change in the number? If they have a whole history of the number documented, then it's very easy. You can monitor progression. But if it's stable, and generally, the patient has achieved a certain age, these procedures are incredibly stable. There are certain large studies which have shown that maybe SMILE has a slight edge in terms of stability vis-a-vis LASIK, especially at the 1 year mark. But nevertheless, as long as the patient has had a stable refractive error in the past, all these procedures will offer incredible stability. To an extent, yes, there's a luck of the draw that, does your number change maybe, 10 years down, 15 years down. With age, once you cross 40, you will become presbyopic, which means you'll have a slight number for near. It's also, the other part of this is a lot of patients say that, oh, this can only be done once. It's important to understand that no, although these procedures are incredibly accurate, still if some years down the road you have a number again, there are still options that we can offer. But again, we have to do all the tests, determine suitability, and if yes, then sure.
So we call this an enhancement or a touch-up laser. So what are the rates of enhancement in your practice, PRK versus LASIK versus SMILE?
So our refractive practice has been there for like 6 years now. In the last 6 years, touch wood, we've not had a single patient with any recorrection. But we've had patients who underwent like 10 years or 15 years ago who had a small number. So again, like Dr. Sartaj said, that we have to do a topography again. We have to see their eligibility only if the cornea is stable, as in if there is any regression, if the power is stable, or sometimes the power could be increasing. We need to make sure again that the power is stable for the last 1 year. If the glass prescription hasn't changed for the last 1 year, then we do the topography. If the topography is normal, then we consider the laser vision correction options. So the technology is more advanced now. So the regression rate has definitely come down. It's less than 0.5%. And the good news for the patient is, yes, there is an option of going for a recorrection. And to answer your question, LASIK is actually permanent. The results are permanent. Rarely we do see some patients getting small number back. In terms of such patients, if the power is stable, then again we can go for the laser vision correction. The misinformation again is a lot of patients and patients relative, they say, "No, number will come back. You might have to wear glasses." But the thing is, it is the presbyopia. So the number after 40, 45 years, you get a reading number. So that is a number that they think that, oh, chashma ka number wapas aa gaya. They say that. That is not true. That's actually the presbyopia. So even if you don't go for any laser vision correction, after 45 years or 40 years, you have to be prepared to wear the reading glasses.
That's a great way to jump into presbyopia. After the age of 40, everyone develops presbyopia, right? It is the refractive error which has a prevalence even higher than myopia, and we spoke about the myopic epidemic. Presbyopia, nobody can escape it. So this is a problem that all of us deal with. Aditya, could you just shed some light for somebody who has no idea about what it is in terms simple to understand for a patient?
So in your younger ages, you've got good strength in your lens, which is inside the eye. So as you are looking at the phone or a book and you're doing any kind of near activities, this lens can change its shape and focus better. So you're able to see very clearly at near. Unfortunately, what happens as we keep aging is that the elasticity and the strength of the lens does reduce as we age. So this makes it progressively more difficult for anybody to do any near activity without wearing a glass. So that's what we term as presbyopia. Generally, the onset is around the age of 40 to 42. And as we keep aging, the power keeps increasing just till about the age of 55. So none of us can escape it. It's just like your hair growing gray. So just like your hair grows gray, you also naturally lose the ability to do your work at near without wearing reading glasses.
White also.
I explain the same thing to my patients, that graying of hair you cannot avoid, that is presbyopia. You cannot avoid, that is going to come even to me also. It's not something that I am telling you as a patient. It comes, the presbyopia, the weakening of the lenses, the difficulty in reading at a distance is something that will hit you at 40. And you realize you are at the target of 40.
Exactly. So the myth is that you can't get LASIK after 40, and a lot of us here do offer these services of getting rid of your glasses after the age of 40, and the treatment is called beyond presbyopia. So you're getting rid of your presbyopic glasses with this procedure, and it's essentially, everyone has a dominant eye, like everyone has a dominant hand that they work with. Everyone has a dominant eye, and the dominant eye is tuned to see better for distance. The non-dominant eye is tuned to see better for near. So we use that same principle to do the correction. We correct the dominant eye perfectly for distance, and we correct the non-dominant eye a little bit more for intermediate and near. So with both eyes open, patients are able to see all distances clearly. So that's the principle behind Presbyopic. So Rohan, you offer Presbyopic for your patients. Why do you call it a game changer?
Actually, it's a game changer. Why? Because the population of presbyopia is also increasing. It's the burden which is going to come to any person, be it 40. Even I'm also scared. I got my smile done, but yes, I'm still 8 years away from getting presbyopia. But yes, presbyopia is one thing that people definitely need glasses. They cannot go without his glasses. So, in times to come, what technology earlier was there, that yes, presbyopic people, if they have both glasses for distance and near, they could get their lenses changed inside the eye. Or they could use multifocal contact lenses, which do not offer the same precision or the quality of vision as the glasses give. So there had to be some bridge in between the presbyopia or contact lenses vis-a-vis glasses. So what came was beyond presbyopia, like you told, that the surgery name is called as Presbyopic. One eye for distance, other eye for near, and the most important part here is the neuroadaptation, which we definitely sit and talk it out in detail with our patient, that the neuroadaptation is something which can take either a month or so or a week to ranging up to 3 months. It's not that and it usually happens overnight. Counseling a patient regarding presbyopic, I usually tell them that there might be certain days that your morning vision is good, night vision is bad, or it can be reverse. Morning vision is bad, night vision is good. Or when you are working inside the room, you're perfectly all right. But usually the adaptation will occur overnight, with neuroadaptation that will set in. Otherwise, yes, it's definitely a game changer in the practice.
Takes a few weeks, probably.
Yes. Yeah.
So my father actually underwent Presbyopic. Dr. Sri Ganesh underwent Presbyopic almost 10 years ago. He got it done by the surgeon who invented Presbyopic, Professor Dan Reinstein, and he till this day is spectacle free, and he's almost 60, right? So it's something we all see our parents and people beyond 40. If you see a dimly lit room and menu cards at a restaurant, they'll all be holding it far away, and seeing it that way. This is a typical thing we see in presbyopia. And my father's friends, when they're all around a table, he reads normally, and they're all like, "How are you able to do that at 60?" Right? So it's function. He's able to function really well without glasses. So his journey was quite interesting. Professor Dan had come to Bangalore for a live surgery session. And he actually got operated in front of an audience of almost 1,000 ophthalmologists sitting in the audience. And it was relayed live for everyone to see how the procedure was done. That's the kind of confidence he had in the procedure after having done it himself. So what happened was he lay down, he was calm, he got the procedure done, one eye after the other. Everyone's talking normally. He sits up on the bed after getting the procedure done. And the kind of confidence you need to do this in the procedure, Professor Dan, who did the procedure, he took a bottle of eye drops. And you all know how tiny the print is on an eye drop bottle. And he gives it to my father and says, read that. This is live, okay, post-op. And he looks at it and he reads it perfectly. And he goes and shows the audience how tiny that is. So that is the kind of precision that we work with. And from that day till today, his vision has only gotten better. And like Arohan was saying, it is a testament to the neuroadaptation that happens, because we are creating a slight difference between the two eyes, and you need to give it a few weeks for that to settle down. But after that, you're flying, and he's been really happy. He does a lot of Presbyon. 90% of his LASIK practice is Presbyon. And 80% of his practice is Smile, and probably out of the other 20%, most of it is Presbyon. So that's been our experience. So what do you tell your patients after Presbyon how to adapt?
Okay, so my counseling begins even before the procedure. So I don't tell them it's one eye for distance, one eye for near. It's both eyes for distance, both eyes for near. One eye a little more distance, one eye a little more near. So that's how we have to explain it to them. So the post-op adaptation usually takes about a few weeks, like you said. The hard stop would be about at 3 months. But generally by the end of the 4th or 5th week, patients are usually comfortable. There's a lot of subjectivity there as well. Some patients are comfortable the very next day. They have no issues whatsoever. Some people will take about 1 week to get there. Some people take about 2 weeks to get there. But generally, by the end of the 3rd month, all of them are fully adapted. So in the post-op period, even though you've told them this beforehand, they might come and say to you, this eye is really good, but this eye is kind of not there. I can see a big difference. I see blurring of the letters. That's usually the non-dominant eye they're comparing. So what I do then is I give them my visiting card and I ask them to close the non-dominant eye and try to read it with the dominant eye, right? And then they can't do it. Then I tell them, now you open your other eye and then they can read it. Then I tell them again, so your eyes are not blurry. You are seeing well. It is just one eye more for distance, one eye more for near. Do not keep comparing it. If you keep comparing, you will just prolong the adaptation process. Just be normal, give it a few weeks, you'll be completely fine.
That's great advice. And do you also do it for post-ops in terms of Smile? How do you feel like the two eyes compare? Not Presbyon as such, Smile when both eyes are corrected for distance.
A similar thing obviously is explained to the patient that you cannot compare. I mean, obviously everyone has a dominant eye. Each eye behaves differently. Biologically, it is, expected to behave differently. And it is natural human tendency. I don't blame the patients also. So next day when they wake up, they're going to compare, close one eye. They even go to the extent of comparing with other patients. So, I mean, something that we have to reiterate at every follow-up that you should not be comparing your right and left eye, and you should not be comparing with other patients also, and give it time. Within a couple of weeks, it's going to settle down on its own.
So how soon can patients read without the reading glasses? For a lot of patients, it's an immediate effect. But on average, what is your experience been?
They're able to read very well the next day. There's no issues with that. See, what we say about adaptation is, it's not that the patient can't see well for distance or far or near. They can see well at all ranges. But it might take them a little bit more of strain. They might need to use a little more lighting in the first few weeks. That's what we call as adaptation. Don't mistake adaptation meaning that you've got to stay at home and not do anything and wait to recover. It's actually quite the opposite. You're encouraged to go back to work and do all your normal activities right from the next day to ensure that your brain is adapting at the correct pace. In fact, I was so surprised. I did a Presbyon for one of my patients on Saturday afternoon. I told him, you can go home and rest, and by tomorrow you'll be all right. Do your routine activities. What I did not know was his routine activity on Sunday morning was biking. So he messaged me on Sunday morning at around 11:30 a.m. or so, and he says, "Doctor, I can see so well now without glasses. I biked to the gym and I finished a full workout, and now I'm biking back." I was like, "Take care, man. Enjoy a new vision."
My father is a biker.
Yeah.
He's an avid motorcyclist. And for a person who's riding for long, I mean, you need to see your console on your bike, you need good distance vision, and you also need to see your phone with the maps on if required. So there's a lot of different distances at which you need excellent vision. And with both eyes open, these patients are completely functional and spectacle free. So that's great. Another question though that patients ask is at 40, your presbyopia may be +1. At 50, it may be +2. At 60, it may be +3.
Yeah.
So how do you then retreat or deal with that difference?
So it depends upon the age at which the patient does present for the presbyon correction. So if they are in their early 40s, let's say between the ages of 41 to 45, we sometimes don't give them the full treatment because the full treatment will be a little harsh for them to handle. They won't be too comfortable with it. So at this age group, what I tell my patients is that when I do this treatment for you, you're probably going to be good for the next 5 years. 5 years later, you will need a touch-up. You might not, you might still be comfortable with the vision you still have, but there's a possibility of a touch-up in the future. Most patients are very agreeable with it because they're very happy that they finally have a solution to be glass-free for all ranges of distance. But if the patient is above the age of 47 or 48, they get the full treatment. There will not be a touch-up necessary until they have a cataract in the future, which usually comes around the ages of 65 to 70. But even then, as you mentioned, there is an advantage if you had presbyon previously. Can you elaborate on that?
Yeah, definitely. If you've had presbyon before, essentially what you have on your cornea is the depth of field. And for cataract surgery, most patients who don't want glasses after cataract surgery require a trifocal lens. Now, in a trifocal lens, what happens? The light that's coming into the eye gets split into different focus points. So if 100% of light is coming in, 50% for distance, about 20% for intermediate, 30% for near. So it's like reducing the brightness on your phone, right? Not all the light is focusing at different points. But with a monofocal lens, 100% of the light focuses for distance. Now, when you have presbyon, you already have the range of vision on the cornea. So what we can do is just put a monofocal lens, which is actually a lot less expensive than a trifocal lens, and have not only the same effect, the effect is better because the light then is not getting split up.
Yes.
The light is just getting stretched and you are able to see all distances well.
Yeah,
exactly.
With a monofocal lens. You're not losing any light. You're at full brightness for all distances. So we've done a series of patients now, about 25-30 patients who've undergone presbyon about 15 years back, 10 to 15 years back, and now have developed cataracts and come back. And they are so happy with just monofocal lenses, and that's a great advantage.
That's what I always tell my patients when they come at the age of 50 and I say presbyon. Want to get cataract at the age of 70? Yes, you will, but it's still better to have presbyon now and then get cataract later, rather than not doing presbyon, having cataract surgery and putting a trifocal lens in,
Exactly.
which will degrade your contrast sensitivity and you won't be able to read so well at night with dim illumination. It's not the case for presbyon.
I've
Yeah,
seen that
it
in
is.
my family. My own father also underwent laser vision correction, and I think Dr. Aditya has been the surgeon of his father. So tell us about what that's like,
Yeah, so that was one very memorable experience to say the least. So my father, I've always seen him wearing glasses right from the time when I was young. I've never seen him without glasses. So his story was he didn't bother getting laser vision correction done because his power was quite minimal until he entered the presbyopic age. That's when it really started to bother him because his distance prescription was quite small. He's able to manage for most of his work for distance without the glasses. But once you hit presbyopia, that's when your near vision work goes for a toss without glasses. You can't do anything. So that's when he really got bothered. So what happened at that point of time is he just went on wearing glasses. He was able to manage with it, even though he didn't like using it. And then we started to perform presbyon about 2 years earlier at our practice. So that's the laser vision correction that we opt for people over the age of 40 who want to be glass free for reading powers as well. It can correct distance power and reading power together at the same time in the same sitting. So what ended up happening was I've done about maybe 100 patients at that point of time. But I was still unsure if my father was a good candidate because his age was 67. Plus, I had some doubts about his corneal topography. Right, so I was a little skeptical whether he would be the right candidate for this procedure. And that so happened that Professor Dan Reinstein, who was the innovator for Presbyopic, he visited India, and at the same time we were able to get him to come to a clinic for inauguration of Presbyopic. And he came and asked me, why hasn't your dad done the procedure yet? I said, I think his cornea is not very stable. Then he said, let us have a look at it. He performed the scans himself. And he said, don't worry, he's clear. You can do the Presbyopic. The moment he said that, I think the day when Professor Dan Reinstein saw the scans, 2 weeks later, I performed the Presbyopic for my father.
Wow.
At that point of time, when I was thinking about it, I didn't feel too nervous. But when it really struck me was when I was washing up in the theater, I'm seeing my dad getting draped.
Wow.
Okay, that really is my father sitting in the preparation chair over there. That's
Who was
when
more
it really
nervous,
struck
father or
me.
son?
What is that?
Who was more nervous, I said, father or son?
That's a good question. But then once you start operating, you just see the eye and then the flow takes over and it's okay.
Yeah, that's not easy. Operating on
So
fathers.
now, at the age of 67, my dad is now totally glass free. He's able to drive, he's able to perform his work. He's seeing patients every day in the OP.
Nice.
And just like how Dr. Rowan mentioned, the next day after getting his Presbyopic, he performed 7 cataract surgeries in a go.
Wow.
And I was the one who was nervous on that day because I was thinking, have I impacted my father's ability to operate? So I was standing on standby thinking, okay, maybe I should take over the surgery some point of time, but no. Back to back to back, no issues whatsoever.
So the proof of the pudding is in eating it.
Yeah,
And
exactly.
you have done exactly that.
Yeah.
But 67 years of age, that's the time when people generally develop cataracts.
Yeah.
Right, 67. And a lot of people, if they want to get rid of their glasses, advise clear lens extraction or just removing the lenses and replacing them with trifocal lenses or something like that. And obviously there is a reason why Presbyopic works even for people at the age of 67 with clear lenses. So
Yes.
what was your thought process in that aspect?
Yeah, so we were very clear in our protocol. So when we did a dilated exam and we were able to see the lens was so clear, there was no cataractous change whatsoever. We also have specialized instruments known as aberrometers.
Yes.
And we're that are able to very accurately estimate how clear the lens is. So the score that we got on my father's eyes was something around 9 out of 10, which means the lenses were perfectly clear. So when the lens is so clear, what is the need to go inside, remove the lens and replace it with another lens that does split light into multiple foci and affect contrast and quality of vision? So rather than doing that, Presbyopic is a better option because it preserves contrast, it preserves quality of vision, it preserves the binocular fusion, and it does correct distance and reading power also.
Yeah.
And I do a lot of Presbyopic as well, and I find that the best part of it is that when somebody after Presbyopic actually develops cataracts, you can just knock off the cataracts and use regular monofocal lenses,
Yeah.
and that depth of field is on the cornea.
Yeah.
So the quality of vision is excellent after cataract surgery also because the Presbyopic is on the cornea,
cornea.
still
Yes.
working
Exactly.
really
Yes.
well.
Yeah.
And aberrometry, like you said, is a great way of knowing whether the lens is dysfunctional. We have a dysfunctional lens index.
Yes. Yeah.
And I
But
think
what about patients who are having like cataract already, like stage 1, stage 2 cataracts?
no, we
No,
don't
we
do
don't
that.
do it.
Not cataract, not even cataract, even a dysfunctional lens. So
Okay.
clinically, if you see a clear lens,
Yeah.
but you do an aberrometry and you see that the internal aberrations are high, that means the lens is not functioning like how a 40-year-old's
Yeah,
lens
lenses.
is functioning. It is going into that very early
Yeah.
stage of cataract. Still, we don't do Presbyopic for these patients. So it's a very thorough set of tests, like Dr. Sartaj also said. It's
But an interesting option for patients who have cataract and are still very keen on presbyopic correction but averse to, let's say, your trifocal lenses, is go ahead, do cataract surgery with the monofocal lens,
Oh.
and you can
Yeah.
do presbyopic after that.
Oh, that's interesting.
And Sartaj was talking about getting Presbyopic after cataract surgery also.
Exactly, because there's a large subset of population out there who underwent cataract surgery maybe 10 years ago. And at that point, maybe the choice of IOLs was more limited, or if they were very apprehensive, and now they're really frustrated with near vision issues. So the beauty about Presbyopic is that even if you underwent cataract surgery with the monofocal lens earlier, you are still a candidate for Presbyopic. So that's like a second chance for truly glasses independent vision, and I think that's the real sort of versatility of this procedure.
So I think with Presbyopic, we are opening up a new sector of population that we were not able to cater to. We can do Presbyopic laser post-cataract surgery. We can do cataract after Presbyopic. There are multiple options now available, which that sector after 40 was deprived of till date. So I think Presbyopic, is present and obviously the future.
It helps us serve a lot more of the population.
So,
And
one doubt, because I don't do too much of Presbyopic. So somebody who knows about Presbyopic and who's worried about getting glass after 40 years, but somebody who's 25 and 30, what procedure would you suggest if they don't want to wear glasses even after 40 years? Do they have an option of going for some LVC now and then doing a Presbyopic later after 40? Or?
We do have patients where they've undergone SMILE in the past. So if you've undergone SMILE at 20 and then you are very happy with your vision for the next 20 years, at 40 you start developing near vision or presbyopia, you can convert those patients into a presbyopia effect, because what happens in SMILE, the distance vision is fully corrected. Now what you want to do is then induce a myopia in the non-dominant eye, and in the dominant eye you want to just give the depth of field because it's already a zero power. So you make the non-dominant eye slightly minus, and you can do that with the excimer laser. You can do it.
That's good.
So the idea is that with all these different technologies available, when a patient comes to you at the age of 20 for myopia, just simple glasses removal, we have to change our mindset from that okay, I'm aiming to do just get rid of glasses right now, to now I'm looking at an entire life cycle of glasses independence from now till 70, 80. And I think again, where we started was that laser vision correction or glasses independence is not the future, it's the present. And compared to when we studied and what we heard from our teachers to what is available now, it's a profound shift. That now actually a 20-year-old, I can say, most likely we can keep you out of glasses for your entire life.
It's so difficult to stay caught up with the trends. And patients, it's understandable that they're confused. I think if the takeaway from this session, if there's one takeaway, it should be that patients need to know that there's a solution at all ages.
Exactly.
You can have a spectacle feel like all your life.
Exactly. Let's jump into some myths that we want to bust. We know that our patients come with so many doubts, and some of them feel a bit unfounded, or they've seen something on social media and they feel like that's a treatment. So Dr. Anuja, I think you've had a lot of patients coming to you and asking you about the ghee therapy for your eyes, right? So can you give us some of your inputs on that?
I think that's a scary video.
It is. I wouldn't blame the patients per se. What is available on social media nowadays, what they end up believing is a different story. A lot of patients do ask me that the hot ghee that if they pour in their eye, will the number be reduced, and will their eyes be cleaned? I don't understand why they want to clean their eyes till date, but it's like a cleansing of the eye that they feel, and with that they think that the number is going to be reduced. I do try to tell them that is still a myth. I don't know till what extent I am able to spread the message to the society, but at least the patients that come in my OPD, I tell them that's a big myth, and that will end up damaging your corneas more.
The eye is a self-cleaning organ.
Exactly.
Let's just make that very clear.
Exactly.
You don't need to put anything inside and clean it.
Even washing your eyes, I think that's also a myth, right? A lot of people tend to wash their eyes with water. Because you have tears that actually keeps your eyes moist, takes care of your eyes. You don't have to wash your eyes.
Disturbs the tear film.
They're like, doctor, how soon can I, after surgery, how soon can I start washing my eyes? Like, no, you don't have to wash your eyes. So that's...
How do you guys address patients who ask about eye exercises to remove glass power?
Take a deep breath. Take a deep breath.
I think what you have to, what I tell my patients when they ask about any kind of exercises to get rid of glasses power is, exercises are for muscles. If you're talking about a number, a refractive error, that is the result of the size and shape of the eye.
Yeah.
You can't really change your height by exercising more. Your height is what it is. So in the same way, the size or shape of the eye, we can only alter it by some kind of surgical intervention.
Yeah.
There are no drops, there are no exercises that can change that as of now.
What about Ayurvedic drops? I think there's a lot of
There-
noise online about that as well.
That's totally a myth that using any kind of Ayurvedic drops will help in keeping our eye health very good. As Dr. Sartaj rightly
Not
said,
only the eye health, even the eye
power.
power.
yeah,
Yeah.
the
What
power
about
also. That Dr. Sartaj rightly said that it's just like height. एक बारी अगर बढ़ गई, once it has increased, it is going to stay there. If you have to make it back to normal, you have to reshape it only. You can do only surgical, no drops. Or have you heard anything that your height will? I am very tall. I want to go through this part, and also I want to reduce my height. Are there any drops or are there any tablets to reduce your height? So this is what general public has to understand regarding the same thing. Once the number is there, it is bound to stay.
Yeah.
And only surgical intervention, reshaping, no Ayurvedic drop. There is no drop to even reverse your cataract. There is no drop to reverse your eye power. Just some localized measures in the form of glasses or contact lenses, or permanent measure, refractive surgery, corneal reshaping. That's it.
So I think there's a lot of misinformation about reducing your power and everything. I think before that, I think everybody needs to understand that having glasses does not mean there's any problem in the eyes. As long as you're reading a 6x6 or a 20/20, which is a normal vision, no matter what the power is, your eyes are perfectly normal. There are multiple options to actually correct that. That is something they need to understand. Just because you're having glasses does not mean there's an issue with the eyes. And different people have, like, his shirt size, my shirt size is different. Does not mean he's normal, I'm abnormal. So everybody's morphology, the shape of the eye, there are different parameters. So as long as your eyes are fine, you just follow a good balanced diet, do some eye exercises, keep your eye power under control. Later, if you're not willing to wear glasses, there are very good options and very safe options that you can explore after a certain age. So that is
And I think
important.
routine eye checkups by an ophthalmologist. I would like to stress
Animal eye
on
check,
that.
Yes.
Yeah, I mean, now people are visiting optician
Exactly.
centers and they say, I get my eyes checked regularly. But what they mean by that is, I've gone to the opticians. And then just got the computer test done.
Yeah.
So what would you say is the difference between that computer test and visiting an ophthalmologist and getting a comprehensive eye checkup?
So I tell them that's a process. Obviously, it's easier for me to visit an optical store, get that computerized test, and I'm in and out in 10 minutes probably. But we all have seen that the power that is given by the optical store and the ones that we actually measure, there's a vast difference in it. So there is a process. It might take 1.5 hours depending on your eye power. There are certain additional tests we will advise, again depending on your eye power, but that is for your own comfort, so that we prescribe you the correct power which makes you more comfortable in your daily activities. So yes, we might ask you to stay here for a longer time, we might ask you to invest in certain additional tests, but that is in the end for your own benefit.
Yeah, absolutely. And we also talk about any surgical procedure having some, side effects. Any surgical procedure does have some margin of side effects, and that's something we just need to accept. It could be something that doesn't bother you at all, like a little bit of dryness, or like Rohan mentioned his experience, for the first couple of weeks he did have a little bit more glare at night, but it settled down.
Yeah.
So what side effects would you say, even though the margin is low, what are the common side effects you've seen?
So I wouldn't call them side effects per se, because most of what you mentioned now, the dry eye and the light scattering at night time that we usually see for the first few weeks after the procedure are all temporary.
Even, sir, I say that it's going to happen to the person who is already having dry eyes before also.
Exactly.
Yeah.
So it's the same thing only after surgery.
Yeah.
If you talk about glare, then I'll start looking at like the glare, right? Then you'll actually see
Yeah.
glare. So, that's
Exactly. So that's a tissue's normal healing response to an intervention. That's it. So you have to be patient enough. You must also not keep focusing on it.
Yes.
If you look for light scattering, if you look for halos and glare, you look for dysphotopsia, you're going to see it more. Just like your floaters. You
Exactly.
look for floaters, you're going to see more of them.
Yeah.
Yeah.
As long as you just ignore it, give it its own time to heal, most of these effects are going to be gone in about a few months' time.
So most of the chance of side effects are less than 0.5%. And in that 0.5%, most of them with time it actually reduces. And these side effects can actually be treated in case it doesn't reduce. So that is what you need to see.
So I call them an adjustment phase. Like, and I obviously tell them beforehand, this things might happen, rather than them sitting on our in the OPDs on the post-op day one. I'm having this problem. I'm having this problem. If you guide them properly, this thing might happen. It's probably a temporary thing, a temporary shift, because we are changing the shape and the structure of your eye. But with couple of few weeks, it's definitely going to go away. So if you prime them beforehand, they're comfortable.
And also the way somebody takes care of their eyes in that post-operative period is so important. It's the difference between somebody being comfortable within 2 weeks versus somebody not being comfortable for 2 years. If you strain your eyes in the first couple of weeks, you continuously have like 18 hours of screen time without breaks, you don't use the drops properly, don't blink, you're in a very dry environment like AC and office. So these are the things. It's like, getting a surgery and then having to do physiotherapy. Although that time is very less after laser vision correction, it's important. So if somebody takes care of their eyes really well immediately after the surgery, then their recovery is a lot faster. There are people who are uncomfortable chronically for a longer period of time. So I think that makes a
I
difference.
think that can vary a lot patient to patient, and you have to again, reassure the patient that these are normal changes. But usually, what I'll tell the patient is, especially after a procedure like smile, that as long as you're comfortable, do it. If you feel tired, if you feel strained, take a break. But other than rubbing your eye and just being irregular with the drops, there's really nothing else that you can do that can cause harm.
Yeah.
So it's just important that be comfortable. Don't push yourself too much.
So again, patient selection, right? If somebody has a severe dry eye, or if they have they're on an immunosuppressant, or they have healing issues, if they have keloid tendencies or something like that, where their healing after surgery is a little delayed, their tendency for scar formation is more. And this is something we all assess in our clinical examination. So like Sartaj said, even for a patient with a lower or a moderate myopia of -3, -4, if they have all these things, the phakic IOL is definitely a better option.
Yeah.
So trust your doctor and trust their evaluation and assessment. Choose them well based on your comfort level with them, and it's a rapport, right? It's a relationship we build with somebody, and that trust is built. So that's really important.
So I sometimes make these patients meet the patients who have undergone the procedures.
Yeah.
So when they communicate with each other, I think they
They
are
relate
completely
better.
satisfied.
Yeah,
Yeah.
we do that.
Yeah.
I want to ask you all one question. So all of us are very active on social media, where we try to educate patients on your eye health and what refractive surgery that they can undergo to get rid of their glasses. But unfortunately, very frequently, almost every day, I get this very typical question. Doctor, my power is -5 or -3. Can I get laser done?
We do get that.
Yeah. How do we address this?
So there is a checklist. I mean, look, like Sartaj said, come in for a consultation. That's the best way to know whether you're suitable. However, there is a self-assessment sort of checklist that you can know whether you're suitable. Not 100%, that you, at least it's a checklist that tells you if you're not suitable, rather. So your power needs to be stable for about 1 year. And you shouldn't have any other eye disease or eye condition for which you have undergone surgery in the past, any trauma or any, kind of injury to the eye. Drops and other treatments that you're taking right now could make you not suitable as a candidate. Other things are tablets that you may be taking. A lot of OCPs or treatment for hormonal conditions, pregnancy, lactation. So if you have any hormonal issues, then your doctor will do more tests to see if you're suitable. A lot of other medications which cause dry eye could make you not a candidate for laser vision correction. So these are some of the things. Would you guys like to add to that list? What are the other
One
things?
I'd like to add, most of the creams which we are using today, both for boys as well as girls, isoretinoid.
Yeah.
So that is one very important component which we have to discontinue with the help of your dermatologist at least for 3 to 6 months.
Yeah.
And after that only we can perform
Yeah.
the laser vision correction surgery.
Definitely. But you still may be a candidate, even
Yeah.
if after 6 months of stopping this medication,
Yes.
you may be a suitable candidate for
Yes.
LASIK. But it's so important to know whether you're taking that. So again, medications, that's why your doctor will ask you an exhaustive list of things. Whether you're on medication, whether you are planning pregnancy or whether you're pregnant. Because that changes your eye power, right? And all these things are something, basically if your power is jumping very frequently and you don't have a stable power, you have a habit of rubbing your eyes very frequently, you have eye allergies, all these things may make you not a suitable candidate.
Yeah.
So if you have this checklist and you know that, okay, I don't have any of these things, my eyes are generally healthy, then you know that coming in for a consultation, we can do the scans and tell you if you're suitable. But over social media, there is
Yeah.
no way
Exactly.
whether we can.
I think the takeaway from this question is it is absolutely impossible for us
Yeah.
to
To
tell a
answer that
patient
question.
over social media whether they're eligible for a laser vision correction. If we look at the eye status, we look at the cornea scans, look at the retina, look at the power, so many things that we have to look at before we can deem them that they're safe for the laser correction.
I think somewhere patients think that we are doing all those tests in order to do the procedure.
Mm.
When I tell the patients that to do the procedure, I pretty much just need your number. That's it. I can feed that in the machine and we can go ahead and do it. The reason why we are subjecting you to so many tests is to actually evaluate suitability.
Yeah.
That is more important.
Which is the most important thing. And that's what really takes time. The actual surgery itself and feeding the data is nothing.
Yeah.
10-minute job to do the
exactly.
surgery, less than 10 minutes.
So regarding the number stability, so what happens is like how your height increases, it stops after a certain age, your number stops. But sometimes you have seen patients who are 23, 24 years coming, doctor, my number has changed. It was 2.5, now it is 3, 3.5. Rarely what happens is they're going to an optician, they're going somewhere else. They're giving a wrong prescription, they're undercorrecting, overcorrecting. So these things tend to happen. So that misinformation, patient thinks that the number is not stable. So actually after 2021, we don't normally see the progression unless there's an eye condition or patients are rubbing their eyes. Otherwise, we normally don't see the progression of the eye number. So I think that is important. And to answer your
Yeah.
question, we get that a lot.
Yeah.
Every day we get patients asking, doctor, my number is -2, -3, can you do LASIK?
Yeah.
They don't understand that the multiple tests that we need to do. We need to do a slit lamp examination,
Exactly.
see,
Yes.
evaluate its physical fitness, even mental fitness, if the patient is actually the right
for
candidate.
surgery.
So multiple things.
So I think it's better to reply to them, just drop in for a consultation and we'll have a safety
They
test.
feel that doctors are arrogant when they say, no, you come down in this thing. Like,
Come see your doctor.
Yeah.
So I think that brings us to almost the end of this podcast. It's been such a great session with myth busting, with personal anecdotes, with sharing our experiences. It's been such a nice morning with all of you.
Absolutely.
And do you guys have any final takeaways? If there's one thing that a patient should take away from this session, what should that be?
So I would say understand your options and definitely trust your doctor. So you have made the effort of coming out of your house and reaching the hospital, which means you have taken the first step. Now let us decide the next step for you.
So I think this was a great session and a lot of takeaways, that a lot of things I've inputs I got from you guys. And one thing I want to tell is from what you said, it's because there's so many procedures and it is important that the patient understands if it's PRK, LASIK or SMILE. I think that's a great point that you made and I'm definitely going to use this. So because in PRK itself, there's so many multiple options, right? So because now there is some procedure which they say that there are 22,000 points. Patient came back saying, no, this procedure has 1 lakh points on your cornea. So ultimately just understand, is it PRK, is it LASIK or SMILE? In PRK, there are multiple options and you can go for the best procedure, the safest procedure, or which is FDA approved. So decide what procedure it is. Wherever you're getting it done, make sure that you clear all your doubts. Spend some good quality time with your doctor And only when you're confident, you know the pros and cons, and then that is when you actually decide and go for the procedure. I think that's a great point, this thing. So it was a wonderful session, and looking forward to more sessions like this.
Yeah. It was actually a very wonderful session. So only one takeaway. So now you have 4 candidates sitting in front of you. LASIK, post-LASIK patient, post-smile patient, post-smile patient, her father,
Family.
family,
Sister and father having undergone
both one smile and one press beyond.
Presbyopic.
And again, the other doctor, his father also underwent press beyond. So you already have testament of 5 people sitting in front of you. So LASIK, press beyond, smile. So you can see that yes, all technologies work the best. All the doctors have undergone the technology which suited their eye the best at a particular time. So don't get carried away, as sir said, that so many points, they scan so many points, they scan so many points. Just trust the technology which the doctor has. Ask, is it a PRK, is it a LASIK, or it is a lenticule based procedure, and then decide accordingly.
So I think this was a wonderful podcast. Hopefully, the information that patients get out of this will help them. So I think the message we have to take away is we have to pay attention to our eye health right from the young age. Ensure that your children are screened every year, and if there is a refractive error, please make them wear the glasses. After they cross appropriate age and once the power is stable, there are plenty of options for us to be glass free. Whatever ages, even if you're 18, if you're 25, if you're 40, there are options for you. Just do your research, speak to your ophthalmologist, and figure out what the best option for you is.
Yeah, I think it was a wonderful morning where we've discussed something which is almost like a public health problem, myopia, and all the certain increase in number of children we are seeing with this. And I think we discussed certain options we can use to control this. And I think maybe in the near future we will see some of these interventions such as drops, special glasses, almost as common as vaccination for children, because if we can control it, that's always better. I hope we were able to reduce the stigma around glasses for children, and stress on the importance that parents should approach it in a positive manner. I think if I had to give a takeaway for at least a refractive surgery is come in for a consultation. Instead of spending all the time online reading, come in for a consultation, ask questions. If you have doubts, go back, maybe research on those. Come back again, ask more questions. Because a consultation is the starting point. Refractive surgeries today are amazing, incredibly safe, incredibly accurate, but they're still not for everyone. There will be still a pool of candidates who we will have to say, continue with glasses. But if you're a suitable candidate, if everything works out, then that's the starting point. Then you go about acquiring, whatever information you want, and then finally reach a decision. So I think come in for a consultation.
So if there was one takeaway that I would think is important from this session is when you go in, first of all, of course, go in for a consultation. But when you go in, ask the right questions. I think after watching this entire episode's patient will have an idea of what questions to ask. Don't fall for names or claims. Ensure that you speak to your doctor and ask in which category does this procedure fall into, because there's a lot of misconception and misinformation. It's a very simple categorization. These 3 categories, PRK, LASIK, or lenticule extraction. Which bucket does this procedure fall into? And also find out whether your doctor offers all of these procedures and what are they basing their recommendation on? Because patients come in asking a lot of the wrong questions a lot of the time. Doctor, which is better for my eye? Or which is better, or my friend got this done, which is the best in the market right now. So the best in the market is very subjective. So ask what bucket the procedure falls into, what is their recommendation based on their assessment, are they offering all types of treatments, and what's the best for their eye subjectively. So if a patient can take away that from this podcast, I think we've all succeeded
Yeah,
here today.
I think if somebody is planning for a laser vision correction, this is one video they need to watch.
Yeah. Yeah. We've answered all the laser vision correction
Yes.
Yeah,
questions.
yeah.
Spectacle removal, laser vision correction. This is the one-stop shop.
Yeah,
Yes.
I agree. Yeah.